The Omicron subvariant BA.5 became the dominant variant in the U.S. last week, according to the CDC. Colorado's variant-specific data is delayed by 2 weeks, so the most recent data set shows it's responsible for more than 38% of our cases, double the week before.
9 health expert Dr. Payal Kohli is joining us this afternoon to talk about this because this one is scary and frustrating, and it's BA.5. It's a subvariant. I mean, they all they're just like bad guys in a superhero movie, They all have their own name. So why is this one so concerning?
So this is a bad guy that came from an earlier generation of bad guy, which is the Omicron or BA.1. So this is a subvariant. So it is an Omicron variant, but it's actually more contagious than the original Omicron. And it has evolved in such a way that the spike protein and the virus actually tricks the immune system. So it evades the antibodies that we're making with the vaccine and with the original infection.
And so many of us have, had COVID by now, and I'm like, all right, I've got my vaccines, I've been boosted, I've got natural immunity, I'm good. Is that the case with this one?
No. And in fact, that is why we're seeing such a spike in cases occurring, because not only are people who've had COVID before with Omicron still able to get reinfected, but in fact, people who've both had COVID with Omicron and been vaccinated are also more likely to get infected with 4 and 5. So this is called an escape variant. It's escaping some of those antibodies that we have. Now lay this all in the background of all the mask mandates going away, everybody traveling, everyone getting together in restaurants and indoors. So you can see why we're seeing such a spike in cases occurring.
And it's hard to tell what the exact numbers are too, because the testing and then there's all that idea of where you go to get a test and false positives with a home test and then hospitalizations. Explain that angle.
We're just going blind this year, guys, because last year at this time, we were doing a lot of testing, and it was all PCR testing.
Right.
So we were getting very accurate results, and we knew exactly what we were getting, and those positivity rates we could follow. But now, with all the at-home testing, we're actually thinking that we're underestimating cases by 7-fold what they actually are. But we're seeing people still end up in the hospital. So we're still seeing thousands of hospitalizations every day. We're seeing hundreds of deaths still occurring, but that's a lagging metric, remember. So it tells us what happened several weeks ago. So it's just really hard to keep track of where we are with
happening right now.
Exactly. That's what makes it so tricky.
I want to play devil's advocate for just a second. Don't get mad at the question, but so many of us have had COVID, we're fine, we're out of work, sick for a couple of days, and we just kind of push through. Why should we be concerned about yet another variant? We've been doing this for years, right? COVID's just COVID at this point.
Right. And it is a virus that lives in the cold family of viruses, except what we're learning with COVID based on new data that just came out. Now, this is preprint, but if you're getting infected over and over again with COVID, your risk of ending up in the hospital or dying from COVID is a lot higher, and your risk of getting long COVID, because now think about it as repeated injuries to your organs with this different, bad guys, but the same version of bad guys, really. So your risk of having long COVID is also potentially higher.
So these vaccine makers haven't put out a vaccine for this one, because I'm ready to go. What the heck is taking so long?
I'm ready to go too, and I'm, to be honest, not sure why it's taken this long, because even Omicron has been around for many months. Even the subvariants now have been around for many months. So the FDA last month actually told the vaccine manufacturers when the fall version comes, 4 and 5, BA.4 and BA.5 need to be on it. Now the question is whether they'll be able to get that together, whether it'll require clinical trials, because with the flu shot, every time we update it, we don't necessarily repeat the clinical trials. Should we do that with this? And will we have a new variant by then, a new bad guy?
Oh, yeah.
Oh, this is exhausting.
Yeah, I know.
I just keep thinking of the octopus guy in Spider-Man, and he had all the arms. I don't know why. I just think it's so annoying.
But in the end, Spider-Man does win. Because
at the end, Spider-Man
he believes and he does the right things. That's right.
Great power.
We can be
great
Spider-Man
responsibility.
too.
Okay.
Thank you.
Thank you, Dr. Kohli.